Now I'd like to turn it over to our speaker today, Dr. Sarah Silcox, who will be joining us for a live Q&A at the end of the presentation.
Thank you so much. So welcome again. I don't know how many of you are joining us and have been following along for the whole cannabinoid lecture track and how many of you are new. So I'm Dr. Sarah Silcox. I'm a small animal practitioner who's worked in general practice, emergency practice, house call practice, locum practice, and I currently operate both an integrative medicine house call practice as well as a house call practice dedicated strictly to palliative hospice and end-of-life care. And I'm also a founding director and the current president of the Canadian Association of Veterinary Cannabinoid Medicine. And Michael, do you want to introduce yourself?
Yep, and I'm Michael Etzier. I'm a veterinary critical care specialist working out of the Toronto Veterinary Emergency Hospital, obviously located in Toronto, Canada. I've been there for the last 10 years and I'm expanding into doing more and more lecturing. So I was more than happy when Sarah and the group reached out to me to join in on this lecture, and looking forward to the next hour.
Perfect. So I think at this point, cannabis has been around for a long time and it's been legal now for the last, I guess we're just coming up on the 2-year anniversary. So we should all know about THC toxicity and be pretty comfortable with that. But could there be more to those cases that we see? So today we want to talk about other risks and adverse effects associated with cannabis use, some of the potential co-toxicities we might see, as well as some risks associated with cannabis cultivation and production. So I'll start by looking at some of the potential risks and some of the components found in commonly used cannabis products, as well as potential drug interactions that we should be aware of. And then Dr. Etzier will jump back in to talk about synthetic cannabinoids, co-toxicities that we may see with edible cannabis products, risks associated with vaporizers and e-cig type products. And then I'll wind things up with a quick review of some of the dangers that we need to be aware of related to cannabis production, both commercial production as well as home cultivation. I think you're all pretty familiar with both THC and CBD, so we'll touch on those really quickly and then just take a peek at a few of the other cannabinoids and a few of the other terpenes or terpenoids that may play a role in the effects that we see for our patients coming in. You guys know THC, it's the primary cannabinoid found in the decarboxylated form of cannabis, particularly the non-hemp cannabis, and it binds directly with both the CB1 and the CB2 receptors, and those effects, that affects multiple neurotransmitters and things like prostaglandins. It's what gets us high, and it's also what's responsible for the majority of cases of intoxications that we see in hospital. And for those cases, I would encourage you to pay attention to the term that you use. I tend to use intoxication, but it has been referred to as toxicity or overdose, as well as just side effects. And so while there's no right or wrong there, I always just encourage you to pause and think about how the term that you choose to use will affect one's perception of what's going on. Although technically the cases that we see in are likely an overdose. Overdose is often associated with death, and so that can have a negative connotation for a lot of clients. Diagnosis has historically been rather challenging. We know that those urine test kits that are available are notorious for having false negatives for various reasons, from different metabolites that are passed in dogs to the level required to trigger a response, or sometimes just the time to onset. Their clinical signs may develop before the metabolites have even passed into the urine. And then we add to that clients' somewhat reluctance to disclose if they know that their pet has gotten into a cannabis product. Sometimes that's because of fear of judgment that may be passed, and sometimes it's legitimately because they just honestly aren't aware that their pet was exposed. So that often leaves us to base our diagnosis upon the supporting clinical signs. I think everyone here is pretty familiar with the ataxia and the lethargy and disorientation that accompanies these guys. One of the features I always like to point out is in the 2012 paper that was put out looking at cannabis or THC intoxication, less than half of them had that classic urinary incontinence. So I know we relied on that a lot in emergency practice to tip us off that it was probably a cannabis issue, but just because they don't have that urinary incontinence, please make sure you're not ruling that one out. Treatment is largely supportive and focused on decontamination and reducing absorption, and then supporting those patients until signs resolve. For some patients, that could be hours. When I was in emergency practice, I don't know about Dr. Etier, but sometimes it was a couple hours wait. So once they were initially triaged, by the time I got in to see the patient and talk to the clients in the room, symptoms were already starting to resolve. In other patients with more severe ingestion, we can see signs lingering for up to 72 hours. The dog requires very little cannabis to show signs of intoxication when they're initially exposed. They can adapt and develop a tolerance pretty quickly, but on that initial exposure, levels are very low to get them presenting into the hospital. But the lethal dose has yet to be firmly established. So obviously those at greatest risks are going to be our small dogs getting into a really highly concentrated, fully decarboxylated form, such as cannabutters or oils and concentrates. CBD, or cannabidiol, has received a lot of attention due to both its potential therapeutic use and its relative safety. So one might ask why I even included it in this presentation. The World Health Organization Expert Committee on Drug Dependence found it to have relatively low toxicity, but they recognized that all aspects had not yet been explored. They also found it had no effect on a wide range of physiological and biochemical parameters or significant effects on animal behavior unless extremely high doses were administered. In monkeys, they were using 150 milligrams per kilogram IV or 30 milligrams per kilogram daily for 90 days. So those are extremely high doses, which again raises a question, why did I include it in this talk? Well, we know it can alter drug metabolism through its action as a cytochrome P450 inhibitor. We have witnessed increased sedation when it's used with some other medications. And in published studies, side effects have been reported, including sedation, increased elk phos in dogs. There was one cat that had an elevated ALT, so we're not sure if that's significant yet or not. Altered alertness, vomiting and diarrhea, changes in appetite. Although many clients report seeing an improved appetite while using CBD, that's likely probably due to overall improvement in well-being. A rat study looked specifically at the effects of CBD on appetite and found that on its own, it actually acted to reduce appetite in healthy individuals. But all of these studies were also using high CBD hemp-derived cannabis products. So those products would have included a range of other compounds, including low levels of THC and minor cannabinoids and terpenoids and carrier oils. So sometimes it's a bit of a challenge to sort out what symptoms are being related to the CBD itself and from the other components found in those products. But realistically, our clients are often using similar products that are not pure CBD. We've also included CBD here because animal poison control centers do get calls about CBD products. Between 2014 and 2017, the ASPCA Poison Control received 51 calls regarding CBD ingestion. And when they did show symptoms, the signs were often similar to those that we'd expect with THC intoxication. So that does raise the question of whether these signs are due to potential contamination or mislabeling. In fact, multiple studies have now shown that many of the products marketed as CBD are mislabeled or contaminated. And so this, again, would support the suspicion that those calls for CBD may have actually been due to something else, like THC contaminating that product, or contaminants such as a synthetic cannabinoid, which Dr. Etier will talk about later. And while there are a number of cannabinoids being investigated for their therapeutic effects, I just want to touch on a few that deserve some mention while we're talking about adverse effects. CBN is a really fascinating cannabinoid. It's produced through oxidation of THC. So it commonly occurs when you've got cannabis products that have been stored for a prolonged period of time. And it maintains anywhere from a quarter or an eighth or a tenth, depending on which reference you read, the potency of THC. It may be mildly intoxicating, if at all, but a lot of consumers will seek it out for its sedative properties. So it's great if you're having difficulty sleeping, but if sedation is not a desired effect, it could be considered an adverse effect. Scientifically, CBN on its own may not actually be that sedating, but it certainly appears to be acting synergistically with THC and with some of the other terpenoids that can be sedating. Delta 8 THC is the lesser known THC, but it is an analog of Delta 9. So the THC we always talk about, it's found in much lower concentrations and it has lower psychotropic effects, but it still produces the sedation that we can see with THC, as well as a lot of the other beneficial effects. And then our last cannabinoid is tetrahydrocannabinol, or THCP, which was just identified as a naturally occurring phytocannabinoid last year. And it received a lot of attention as it was found that it had 30 times the binding affinity for the CB1 receptor compared to THC. So that caused a lot of stir, but that doesn't mean it's necessarily 30 times more potent. In fact, it does have very similar effects to THC, but it requires only about half the dose to do so. So those THC intoxications may not just be THC, they may also be THCP playing a role. So let's just take a really quick look at terpenes and terpenoids as well. These are considered the essential oils of the cannabis plant. And although terpenes are found in low levels in the plant, they can still have profound effects. Unfortunately, we don't usually know the terpene profile of the products our clients are using. The types and amounts of terpenes found in a given plant can vary significantly depending on the genetics, the growing conditions, the harvesting, the processing, and the storage of those products. What we do know is that at natural plant levels, the risk of toxicity is really low, but newer products are coming to market that provide more concentrated terpenes, much like other essential oils. So again, if we think of these as essential oils, they're volatile, unsaturated hydrocarbons. They have really strong characteristic odors. They serve as natural protection for the plant. And even though they occur at very low concentrations, they can have very potent effects. Oxidation can alter the terpene or terpenoid function, and in some cases it makes them more effective. So beta-caryophyllene, when oxidized, actually works really well. More toxic changes can occur with things like linalool. And there's always that concern with cats. Again, we talked about this in our last session as well. Are cats particularly sensitive to terpenes because they are deficient in glucuronidation? And it certainly doesn't seem that it's been a problem clinically, but again, when we start talking about newer products coming out that are more concentrated terpenes, then we have to think of them more as these pure essential oils and the potential toxicity of those. And so, as with all essential oils, more concentrated products and acute exposure are likely to pose a greater risk than low-dose chronic exposure. And so, again, those low doses commonly found in the cannabis products might not be a concern, but the photo on this slide shows concentrated terpene products that are available for purchase, either condition specific, so you can get combinations of products for stress relief or anxiety, or you can get combinations that are specifically blended to match specific cannabis chemovars or strains. If you had an opportunity to catch either Dr. Mosley's lecture yesterday or Dr. Andre's lecture earlier, you likely heard about some of the more common terpenoids. Myrcene has actual opioid-type analgesic effects, so it shouldn't be a surprise that we can see sedation and muscle-relaxing effects with products that have high levels of myrcene. Nerolidol is also being explored for lots of potential therapeutic applications. And it can have synergistic sedative effects when it's combined with compounds like THC, CBN, or myrcene. And then the last terpenes we're going to talk about are linalool and limonene, which are both commonly found in cosmetic products and cleansers, and they both have insecticidal effects. So sometimes we'll find these in natural flea products. We know that linalool can be relaxing, which may be interpreted as being a little bit sedating. Think lavender baths and lavender oils, which are rich in linalool. But in more concentrated forms, GI signs like salivation, lethargy, hypothermia, they've all been reported. And in cats with high levels of dermal exposure, more severe signs such as tremors and weakness, ataxia, dermal lesions, low blood pressure, recumbency, we've seen all of those. So again, these are always with more concentrated products. And to the best of my knowledge, we haven't seen issues in concentrations that are normally found in cannabis or legally available cannabis oils. Drug interactions. I better go through this even quicker. We get questions a lot about potential drug reactions, and the answer is yes, there are lots of potential interactions. In addition to cumulative sedative effects that we can see, we know that cannabis is affected and is affected by the cytochrome P450 pathways. Both CBD and THC are metabolized through cytochrome P450, 3A4 specifically, and CBD acts as an inhibitor for both the 3A and 2C enzymes, as well as likely several others. But exactly which drugs use which enzymes in a given species is still largely unknown, as is the dose that may be required to cause inhibition or induction. So what happens in people may not always happen in dogs or rats or cats. A few years ago, I put together this graphic to show some of the possible drugs that can be affected by cannabis. Cytochrome 3A4 inducers such as rifampin have been shown to reduce THC levels by 20 to 40% and CBD levels by up to 50 to 60%. And inhibitors like ketoconazole have been shown to increase concentrations of both CBD and THC, again, because those cannabinoids are relying on those enzymes to help metabolize them. But like ketoconazole, CBD also acts as an inhibitor of that enzyme, which potentially slows down the metabolism of THC. And we touched on that in Dr. Kolfa's presentation earlier this morning. So again, these are mostly theoretical interactions. Clinically, a lot of the effects haven't been seen, but we do need to be aware of them. I thought I was doing a really good job at making up that last slide, but recently the Penn State Department of Pharmacology put out this list of 57 narrow therapeutic index drugs that may be affected by cannabis use. The list includes drugs that we often use in veterinary practice, such as aminophylline, amitriptyline, clindamycin, cyclosporin, doxepin, fentanyl, levothyroxine, phenobarb, propofol, tacrolimus, theophylline, warfarin. And then they went on further and put out a larger list. There are 6.5 pages like this one of drugs that may be affected by cannabinoids. Again, does it mean it always happens? Not necessarily, but we do need to be aware of this. Really, the take-home message is that some inhibitors can increase levels of THC and CBD, and some inducers can decrease the blood levels of THC and CBD. And CBD acting as an inhibitor might increase blood levels of drugs that are using those same pathways for metabolism. Or it may work in the opposite way and reduce the effectiveness of a drug by inhibiting the metabolism of drugs that work through a metabolite. So something like trazodone, we don't actually rely on the trazodone itself to be the active component, but rather its metabolite, chlorophenylpiperazine. And that was actually just brought out, this paper was brought to my attention last night. Thank you, Stephen, if you happen to be watching this. And it actually looked at cortisol levels as part of an overall fear response in dogs that were getting either a control, so nothing, or trazodone, or CBD, or a combination of trazodone and CBD. And while they found that trazodone reduced cortisol levels in these patients that were sort of being exposed to a simulated fireworks situation, CBD did not. And when they combined CBD and trazodone, the response to that cortisol drop was actually muted. So that may have to do with that interaction as well. In human studies that were done during the development of Epidiolex, which was a high CBD product for seizures, they looked at its effect on multiple anticonvulsants, and they found that the use of CBD significantly altered the blood levels of several of those anticonvulsants, including things like phenobarb and Keppra, which raises a concern about how it may affect our patients who are getting anticonvulsants. And yet, when we looked at the study that used CBD for the treatment of refractory seizures in dogs, those changes were not reported. There were no significant differences in serum phenobarbital concentrations.
Thank you, Sarah. So I'm going to talk about something that most people probably are not overly familiar with, and that's synthetic cannabinoids. These are man-made structures developed in a laboratory setting that allowed us to initially start studying the endocannabinoid system. Unfortunately, over the last decade or so, we now have criminalized groups that are mass producing these to a large scale and marketing them because of their psychotropic effects. They are effective in doing so because it's such a lucrative market. We're talking about you can buy $2,500 worth of laboratory formulated product, blending it, so dissolving it in a solvent, spraying that on an innocuous dried herb, or mixed in with some e-juices, and we'll talk about e-juices in a few slides. And that product now becomes a $500,000 sellable psychotropic drug. The reason why it's a concern for us is that these products not only have a stronger affinity for the CB1 receptors, but they're found to be somewhere between 85 to even upwards of 100% more potent than, let's say, our organic THC, which means the side effects our patients are going to exhibit are going to be much more severe. Also, because this product is a black market product, there's going to be absolutely no quality control. They're finding more and more now that they're adding chemical additives to try to prolong the effect, because again, this is being used for recreational purposes. So then we're getting kind of this co-toxicity effect showing up in patients. Next slide. So although it's new in the veterinary world, I think we also have to appreciate that as clinicians, myself included, we may not be aware of some of these severe presentations actually being caused by this synthetic drug. There was an example in 2014 where a human was smoking this product, so smoking the recreational drug called Spice. And in his room was his dog. His dog started showing sensitivity and neurological signs. He brought that dog to a veterinary clinic. During the examination, that pet's neurological decline was quite rapid, progressing to seizures. And then shortly thereafter, the human developed very similar clinical signs and was brought to an emergency department. With further diagnostics, they found that both that dog and the pet owner were exposed to a synthetic cannabinoid. There are reports, there's actually 2 now in the veterinary literature of dogs, one confirmed because they were able to do testing, another one highly suspected of dogs being exposed to synthetic cannabinoids. And the big thing here is that the dogs develop much more pronounced or severe neurological signs than we would typically associate with THC exposure. So those who are in the clinical environment, who probably like myself are seeing 10, 20 cases a month now because of legalization in Canada, they're not going to present like the typical dog with THC. They may start initially, but their progression is going to be much more severe, and the clinical signs are going to be quite profound, to the point where some pets are requiring ventilation. Although this has not been reported in the veterinary literature, there was a cluster of cases in the US in humans that also developed severe coagulopathies, and that's because that product was laced with vitamin K antagonist. So again, I think we have to be aware that dogs presenting with unknown or unexpected neurological signs and other comorbidities, that this may be the underlying cause. The good news is most of this, with aggressive treatment and appropriate clinical setting, is in fact treatable, although you can appreciate with coagulopathies and that the cost will be quite high, but most patients, humans and veterinary, are surviving these interactions. Next slide, Sarah. Although perhaps less severe from a clinical perspective, although significantly more common, are the edibles that are now becoming more prevalent, and as a result, we're seeing more presentations in the veterinary literature. Sarah touched base a lot on what we see as a standard presentation for THC when it's smoked and the pets are exposed in that manner. We're going to see the very similar clinical signs with the edibles, although generally the effect is going to be apparent a little bit later because it's being ingested and has to be digested before it reaches the bloodstream and the CNS system. And the effects tend to be a little bit more profound and a little bit longer in duration. But again, we're going to see very similar presentations to what Sarah described with the THC. Next slide. what I want to focus on is this idea now that cannabis is becoming very popular in a means to cook. And we're talking anybody who wants to expand their exposure from simple smoking to cooking with it can do a Google search. You'll get endless websites walking you through how to cook with cannabis. You can pick up books that looks at baking or cooking. So we're talking full course meals here. In fact, you can even go on Netflix with your self-isolation and watch Martha and Snoops or Cooked with Cannabis. So again, I think there's a growing popularity of using cannabis, both for medicinal purposes with our CBD or recreationally with our THC users, and now exposing that to our veterinary patients. Next slide. The reason why I think that's important is we're seeing an increasing amount of co-toxicities. So again, my focus is not going to be on the THC, CBD side of things, but rather when we're baking or cooking with these products, are potentially other co-toxicities being present that normally as humans we don't think about being concerning, but yet because of our veterinary patients having different sensitivities, they now become a concern. And when we think about co-toxicities, they may act synergistically, meaning that they're going to augment the side effects that we typically see with THC, or they're going to be suppressing or opposing the effect of THC. And that's important because it may mask the severity of their exposure, or it may delay the true exposure of the secondary co-toxicity when one product effect runs out. Next slide. So what are these co-toxicities that we're seeing more of? Well, by far, one of the most common is chocolate. So as many of you know, the active ingredient in chocolate that causes our clinical concerns is theobromine. Although both dogs and cats can be clinically affected by this, because dogs tend to have more indiscriminate eating habits, we tend to see a larger population of dogs presenting for chocolate toxicity. It has a very rapid onset of clinical signs within the first 2 to 4 hours. So usually we're going to see those symptoms after the onset of THC clinical symptoms. At lower doses, we're going to have predominant GI signs, so that's vomiting, diarrhea, in addition to the excitation we normally see clinically. In mid-range dosages, we're going to see more cardiac involvement, so you're going to see persistent tachycardias or arrhythmias, and much higher doses in the 60 milligrams per kilogram of theobromine, you're going to see tremors, seizures, and more profound CNS effects. The good news is the vast majority of cases, even the CNS involved cases, will have very good prognosis with early treatment, and the treatment is not overly expensive, which is always important in veterinary medicine. Next slide. So chocolate, it's important to consider decontamination. So again, although clinically I tend not to treat the vast majority of THC exposures that come through emergency clinic because they're quite mild and they'll wear them off for the next few hours to maybe 12 at home. If I'm worried that there's been a co-toxicity with chocolate, then we are going to talk about inducing emesis. We are going to administer charcoal. And unfortunately, because there's enteropathic recirculation with charcoal, we're going to administer that every 4 to 6 hours for about the first 24 hours. Really, really severely CNS depressed patients who are recumbent or heavily sedated as a result of the medication used to treat them may have indwelling urinary catheters, because chocolate can also be theobromine can also be reabsorbed through the bladder wall. So in those animals who aren't able to be walked frequently to keep their bladder empty, urinary catheter, indwelling catheters are important. Again, depending on the dosage, it may be simple sedatives. Acepromazine is probably our most reliable one, and some GI support depending on the severity of the GI signs. We may have to involve beta blockers like propranolol or antiarrhythmics if we're seeing more cardiac signs. And I always caution veterinarians that because the vast majority of patients will come in with excitability as a primary clinical concern with GI signs, I recommend sedating them first. If tachycardia persists once the patient is no longer excited, so once the sedatives have kicked in, then generally we start worrying about that being a predominant cardiac effect, and we will then treat them with beta blockers. So we tend not to use the beta blockers firsthand until the pets are sedated, because the excitation can drive the tachycardia as well. And obviously with CNS signs, we're going to start looking at things like diazepam or phenobarbital if seizures are present, although those tend to be less common signs. Another group that's involved in the baking with cannabis products are raisins. Again, you can see grapes and currants causing clinical symptoms. We just tend not to see them as commonly used in cooking. Although again, I think with recipes becoming the norm these days, we may get them as well. The toxic source is unknown, and it seems to really only be affecting dogs and not cats. although an individual dog's response is going to be quite variable. And I see that from experience. Before knowing 10 or so years ago that raisins were toxic, I used to use them as a treat for my own dogs and never once encountered GI or acute kidney injury. And I'm sure many of you guys have felt the same. So there's definitely a huge variability amongst the dogs. GI signs are very, very common in dogs who are susceptible to it. So you will see vomiting within the first 24 hours in the vast majority of dogs who ultimately will be sensitive. And only a small percentage of those will actually progress to developing acute kidney injury. And by far, the vast majority of those patients will actually not even develop any clinical sign or concern. Unfortunately, because we don't know which dog is going to develop severe signs or progress to acute kidney injury, the recommendation still by poison controls are to treat these patients for up to 72 hours. And that involves emesis, charcoal, and then supportive care to keep the patient hydrated to limit further kidney injury. And that's reported to be as long as 48 to 72 hours. Again, the prognosis is quite good. It can be concerning if there's severe kidney disease, although those tend to be the smaller of the groups. One thing to keep in mind though, because a lot of these dogs will never develop clinical signs, and we can't really measure a documented lethal dose or clinical dose, a lot of these owners will treat these patients as outpatients. And I think that's very reasonable. One thing that I always educate owners on is if your pet, after coming to the clinic, who's undergone emesis and a charcoal administration, is sent home for at-home monitoring, if you develop signs of vomiting in your pet or you see signs of vomiting, that would be reasons to represent and possibly have your pet either monitored in hospital and on IV support, or at least have more close monitoring of their kidney function, because that seems to be a dog who's now susceptible. Whether they develop the kidney injury, we're not quite sure, but we should monitor them more closely. Next slide. Another one that some people are probably not as familiar with, but we are definitely seeing more of this, is macadamia nuts. Again, this is only dog specific, so we're not going to see this in cats. We don't really know the toxic source, nor do we know a predictable dose that's going to lead to clinical signs. So we're a little bit in the unknown there. What's important about this is that this is going to have an additive effect with THC toxicity. So we're going to see severe weakness and ataxia, depression, sometimes hypothermia, and even vomiting. So we're going to have very similar signs to dogs who present with THC. Those signs are going to manifest a little bit later than THC, so probably closer to 12 hours after ingestion. And that's important because clinically, for those who see a lot of THC exposure in dogs, by 12 hours, the vast majority of dogs are not clinical anymore, or at least showing signs of improvement. So macadamia nuts, if present, are going to prolong that effect. And in fact, we can see it quite severe sedation or weakness involving up to 48 to 72 hours in these patients. So think of it as a very prolonged THC type scenario, but not at all to do with THC, but rather due to macadamia nuts. The prognosis is very good in these patients, although they can look quite neurological and sedate. They just need to be supported, and within that 2 to 3 day window, they'll be back on their own. Next slide. Xylitol is another one. So although there's no products marketed, so if you go to the Ontario Cannabis store, you're not going to find any products for humans that also contain xylitol. But again, the concern here is the large amount of at-home cooking or baking that's undergoing right now. And therefore, people may be incorporating xylitol into their own products at home. This is a natural sugar sweetener. It's going to affect dogs only. But again, there's a huge variable response. Some dogs show no clinical signs. Others hypoglycemia because of massive insulin surges as a result of xylitol, and some will occasionally develop liver injury and some even liver failure. Liver hypoglycemia, we tend to see more closely in the 1 to 12 hour range, so it's going to happen fairly quickly. Whereas unfortunately with liver impact, we're going to see that perhaps as early as 4 hours, that's the earliest documented report, to as long as 2 to 3 days. So we do have to be aware that there may be a delayed effect in that. Next slide. The vast majority of dogs will show signs of vomiting with xylitol ingestion, regardless if they're ever going to progress to showing signs of hypoglycemia or liver injury. If there's a documented dose that we can measure, less than 50 milligrams per kilogram is unlikely to lead to any clinical symptoms. Once you start exceeding 50 or approaching 100, you're probably going to have mild, short durations of hypoglycemia, but those patients may still require hospitalization for 12 to 24 hours. Exceeding 100 milligrams, you're going to get more severe cases of hypoglycemia and more prolonged durations of hypoglycemia. So these patients are likely to be in hospital for a couple of days. And once you exceed 500 milligrams of xylitol per kilo, the risk of liver injury becomes apparent. However, not every dog that has that dose or above will in fact develop liver injury. In fact, there's reports of dogs getting into 3,000 milligrams per kilo and yet show no clinical symptoms of liver injury. So again, there's quite a bit of variability there in our dogs. Next slide. Unfortunately, decontamination is not very effective in these patients because they do have that self decontamination with the vomiting that's triggered. So they only recommend inducing emesis in patients who are asymptomatic at the time of presentation, and don't bother trying to get charcoal into these patients. It's ineffective. It doesn't bind xylitol. So for those that either haven't self-decontaminated or those following decontamination, a lot of patients you can just monitor for signs of hypoglycemia, either in hospital for 12 to 24 hours or at home. Those who in fact do develop hypoglycemia should be put on a IV dextrose supplementation. But keep in mind that the higher doses of xylitol, we're talking the 100 milligrams plus, patients will likely also have decreases in their potassium and phosphorus because insulin will cause transcellular shifts of those electrolytes as well. So in addition to dextrose, make sure you are monitoring those two electrolytes and supplementing them accordingly. Interestingly enough, it's still recommended to give antioxidant support for patients with severe or high dose xylitol exposure. So we're talking SAMI or denameron as oral equivalents, or N-acetylcysteine in intravenous supplementation. Yet there's actually no scientific evidence that's proven that it is beneficial or not. With that said, there's also no evidence to say that it's harmful to these patients. So you're still likely to see those recommendations in the literature or by poison control. It's not wrong to do it. Just recognize it may not be having any benefit. So if there's cost concerns, I probably wouldn't put my resources into that, but you're also not likely to have any side effects. Keeping in mind that just because there's elevations in liver values, so ALT, ALP phos, etc., sometimes bilirubin in severe cases, that doesn't mean that every patient's going to progress to liver failure. However, if severe injury occurs and liver failure is present, you're going to start to see things like hepatic encephalopathy, so the neurological manifestations of this, or coagulopathies. And those patients will benefit from vitamin K or plasma transfusions, supporting them through their liver injury. Next slide. So although this sounds very detrimental, in fact, the vast majority of dogs who are exposed to xylitol will do quite well. And the earlier reports, I think, had a lot to do that we weren't aware that xylitol was toxic, and therefore they presented much later in their course of clinical symptoms, and therefore their treatment was instituted at a much later time point. So early interventions generally result in a good outcome. There was a large case review in 2015 that was published of almost 200 cases, and all 100% of those cases survived, okay? One thing to keep in mind, none of the dogs in that group did develop liver injury, but again, it just shows that the vast majority of dogs, even exposed to higher doses than 500 milligrams, which many of the dogs in that study were, don't always develop liver disease. And a more recent update on xylitol as a whole shows that really the prognosis is only guarded in the patients who do develop true liver failure, so not elevations in liver values per se, or those that have refractory hypoglycemia. Those tend to be the ones with the worst prognosis. Although as a criticalist, I always put that caveat out there that just because a dog has a poor prognosis and owners elect for euthanasia doesn't mean that in the right setting with the right owner who can afford more prolonged care or can access, tertiary care level care, that a lot of those patients will in fact still do well. So we've treated these patients and have gone to discharge them 2, 3, 4 days later and have continued to do very well. But yes, they will require more intensive management and care, which unfortunately may result in higher costs. Next slide. And lastly, we don't really see a lot of this in veterinary medicine, but again, with the cooking being so prevalent with cannabis now, I think we have to be aware that in a lot of recipes, there's going to be things like garlic, onions, leeks, and chives, and all those are part of the allium species group, which can be toxic to dogs and cats. Again, dogs generally are going to be a higher risk because they're more likely to be the ones that steal the meal off the counter, or owners are going to feed them some scraps after supper. The concern here is it leads to oxidative damage and hemolysis in patients. So therefore, we do have a risk of anemias. A lot of these dogs will have GI signs concurrently. We don't know if that's because it's rare that they're just going to be fed pure doses of onions or garlic, but rather it's going to be mixed into a meal, and maybe it's that dietary indiscretion that triggers our GI signs and anorexia. But a lot of the patients will manifest that way, and only a small percentage will progress to truly requiring transfusions and treatment for their anemias. Emesis is recommended within the first 2 hours of exposure, and charcoal as well, again, to just reduce absorption of these products and therefore reduce the ultimate endpoint for the patients. But again, prognosis is going to be quite good even if transfusions are required. Next slide. Another area that I think we have to become increasingly more concerned with is this idea of exposure to vaping products or vaping e-juices, which is just the liquid itself that is heated when using vaping pens to produce the vapor that people inhale. And the reason why we're seeing increasing amounts of this is because vaping is being promoted as a safer alternative to smoking, the standard, combustion of our dried herbs or nicotine. And the reason why that's important is that in vaping syringes, we have a much higher concentrations of our products of either nicotine or our THC or CBD products, anywhere between 3 times to 10 times the concentrations. And also, because these products are intended to be vaped or heated, and then the vaporizers that are produced are inhaled into the lungs, our concerns with the veterinary world is that dogs, more so than cats, will actually chew on these products. And when they chew on it, they actually absorb these liquids through their GI tract and through their mucosal surface. And that leads to rapid absorption. And that rapid absorption is so quick that it actually limits our time to decontamination. So these patients will actually present to us in fulminant clinical symptoms of either nicotine or THC CBD exposure, and we don't have a lot of windows of time to treat them. Next slide. So again, I don't want to focus too much on the THC or CBD aspect because, again, the symptoms are going to be similar, but I do want to focus on nicotine because a lot of times people are mixing CBD into their e-cigarettes and adding them to it. And nicotine is really where our concern comes from in veterinary medicine. So nicotine will act on our autonomic nervous system. So we're going to have CNS, cardiovascular, and GI signs. Again, because of the rapid absorption of this product that's intended to be inhaled, but rather ingested by our dogs through chewing, it's going to be absorbed initially in the mouth, the mucosal surface, and then continued on into the small intestine and GI tract. Toxicity occurs at very low doses, 1 to 2 milligrams per kilo, and we're easily going to see that in these products and upwards of much higher concentrations. We're talking 36 to 50, 60 milligrams of these products are very common. Lethal doses happen around 8 milligrams per kilo. So again, small patients don't take a whole lot before they're going to get exposed to these toxic doses. Peak effects occur within about 4 hours and last only about 12. So the good news here is even though it's severe, our window of opportunity to treat is small and therefore costs can sometimes be kept at a minimum. Next slide. So again, rapid onset, we're talking less than 1 hour. The good news is nicotine will trigger in the vast majority of patients central emetic centers, and therefore there's going to be profuse vomiting. So they're going to self-decontaminate themselves, and rarely are you going to have an opportunity in the clinical setting to induce emesis yourself because of how quick the onset of signs will be. At lower doses, we get more of a stimulatory effect from nicotine. So that's your sympathetic nervous system. You're going to have excitation, tremors, salivation, vomiting, diarrhea, increased heart rate, respirate, blood pressure. And that's quite readily treatable. And usually, like I said, in that first 4 to 12 hours, we're going to be able to manage those symptoms accordingly with IV therapy and in-hospital monitoring, similar to our chocolate toxicity dogs using similar therapies, but actually at much, much higher doses when we're approaching that 5, 4, 6, 8 milligram per kilo, that's when we're going to get the inhibitory effects. So that's when your parasympathetic system is involved. You're going to get ataxia, muscle weakness, bradycardias, decreases in heart rates and hypoventilation and hypotension. And those patients are much more severely affected. Those are going to require intensive management, sometimes even ventilation. Again, the good news is it's usually only for that 12, 24-hour window, but the symptoms are quite severe and the treatments are quite extensive. So that may limit which pets are going to be able to be treated. Next slide. So again, focusing on our sedatives, our beta blockers for the low doses, and things like epinephrine, phenylephrine for blood pressure management, or atropine for those tachycardias. Next slide. Propylene glycol is actually the solvent that's within these e-juices, which is part of that e-cigarette. And again, it can lead to clinical symptoms if the dogs chew and ingest that. It will lead to a metabolic lactic acidosis and subsequently CNS depression, ataxia, some GI signs with nausea and drooling, and occasionally, and specifically in cats, we may see Heinz body anemia. The good news is in most products now, we're moving away from propylene glycol as the solvent and using more organic vegetable-based solvents. So we should probably see less and less of this over time. Next slide. And lastly, there is a potential that the vapor itself can be irritating, although with more and more research, that seems to be less likely the case. Although I think when we get less standardized products, so if people are buying things in maybe less reliable markets or less controlled markets, we're more likely to see other compounds mixed into this. So again, the research shows that there's a lot more to these products once they're vaporized than simply just nicotine or propylene glycol or CBD. There's a lot of other toxic properties that seem to be available. The literature out there seems to be that if we're going to see side effects, it's going to be in our patients that are predisposed. So we're talking about patients like dogs that have chronic underlying bronchial or airway disease, or cats with feline asthma. That's the population that are going to be more affected by the vapor itself. But in reality, the concern with the e-cigarettes or the e-juices is really that indiscriminate ingestion, chewing on the vape pens, chewing on the contents, and getting exposed to high doses of nicotine. Next slide.
That was awesome. Thank you so much, Dr. Etier. So I'm going to just finish up today's presentation talking about both contamination risks as well as home cultivation risks. And there's a lot of overlap between the two. Yesterday, I spoke very briefly about the ability of cannabis to accumulate toxins such as heavy metals from its growing environment, and then to be contaminated by things like pesticides, microbes, and solvents during cultivation and processing. For cannabis that is contaminated with these products, when they then are destined for extraction and concentration, one of the concerns is that there is a significant risk that those contaminants, particularly the pesticides, will be concentrated even further and pose a greater issue for the end user. Now, one of the benefits to veterinary use of cannabis products is that unlike human consumption that frequently relies on inhalation, most of our veterinary patients are being exposed through ingestion, and the safety limits that are set have generally been based on either skin contact or ingestion. But there's been a lot of concern on the human side of things about how those limits that are set for ingestion or dermal contact translates when we're actually inhaling those toxins. So again, thank goodness that doesn't really seem to concern us nearly as much as it might for our human physicians. Solvents are products that are used in processing cannabis to extract the components like the cannabinoids and the terpenoids for the production of concentrates and extracts and oils. Some of the solvents that have been used historically, while effective, are highly combustible, and they can pose a significant risk to the people involved in extraction. And the Ontario Fire Marshal actually had to put out a warning when cannabis became legalized to caution people against the use of these combustible solvents for processing cannabis products at home. Aside from that risk, if it's not fully extracted during processing, who wants camp stove fuel or rubbing alcohol left as a residue in your medicine? I know I certainly wouldn't. In the US, they broke down solvents into different categories, ones that should be avoided because they're known human carcinogens or they're known to have ozone depleting properties. And then they have class 2 solvents that are animal carcinogens or agents with irreversible toxicity or reversible but significant toxicity. And then those with low toxic potential, which are the ones that we try to aim for when we're using solvents for cannabis processing. Compared to a lot of the solvents that have been used, supercritical carbon dioxide extraction is a much safer method, but it's also more difficult and costly. They use a liquid CO2 as the solvent, and then using really sophisticated machines, they control the temperature and the pressure, and processors can target different components of the plant material to separate and drop out of the mix. And then after the pressure is released in those machines, the supercritical CO2 reverts back to a gas and just disappears out of the extract. So it doesn't represent a health risk to the consumer. And thankfully, this is now by far the most common method of extraction used by most of the licensed producers. In Canada, legally produced cannabis oil is subject to solvent limits that are set by the government. So they include 28 solvents that have a limit set, and then 3 solvents that have no limit set. And that's for things like water, nitrogen, and CO2. Outside of those three very safe solvent, we do know that repeated exposure to residual solvents have been reported to cause health issues like allergic reactions, headaches, nausea, very vague symptoms. So it's certainly something we want to avoid. Many of us have probably heard about heavy metal toxicity, whether it be in animals or humans, things like lead and mercury being two of the more common ones that we hear about, things like the Mad Hatter, that was mercury toxicity, lead toxicity in children and animals who are chewing on old painted surface and toys that used to have lead in it. And while acute poisonings are unlikely simply from the consumption of a contaminated cannabis product, chronic exposures can lead to really vague symptoms such as headaches and weakness, tiredness, achy joints and muscles, and some vague GI signs. Thankfully, Canada does require that all cannabis products also be screened for heavy metals. However, those products that are being sold outside of the legal channels are not beholden to those regulations. And we have two studies that looked at the composition of black market cannabis products for pets. One of them was done in the US, and they found heavy metal contamination in 4 of the 29 products tested. 3 of those were contaminated with lead. And then here in Canada, they found one of the products that were tested had 8 times the maximum permissible level of arsenic that would be permitted in food. So certainly heavy metal contamination is still a concern, mostly on that unregulated market. No producer that's growing cannabis wants to lose a crop to pests. So there is constantly this push to find better ways to manage pest control. There's an extensive number of pesticides that have been used in cannabis cultivation. Canada has banned 96 of them, and those are routinely screened for in legal cannabis products. In their place, producers are encouraged to use safer practices such as insecticidal soap or canola oil, diatomaceous earth, and beneficial microorganisms. And as you guys all know, microbes are everywhere. Cannabis is no different. And we have found a range of bacteria and fungi that have been found during laboratory testing of cannabis products. Sometimes those microbes develop during growing, and other times they're introduced during handling and processing. They pose the greatest risk when they're consumed via inhalation, particularly for immunocompromised patients. Fortunately, that's not a huge concern for our patients who are generally ingesting their cannabis products. To address this, some cannabis producers will sterilize their plant material via radiation, either gamma radiation or electron beam radiation. But even with a sterilized plant material, you can have microbe proteins that can trigger allergic reactions or microbial toxins that persist even after the eradication of the causative organisms. Things like aflatoxin exposure is nothing new for animals. We see dogs that have had chronic aflatoxin exposure due to contaminated feeds, and we know it can cause liver disease and cancer. Interestingly, while I was preparing for this, I came across a study that showed that myrcene, in synergy with CBD and CBG, 2 of those cannabinoids found in cannabis, has been shown to block hepatic carcinogenesis caused by aflatoxins. So cannabis may actually be the fix for cannabinoid contamination. Finishing up, I want to touch on home cultivation risks. Across Canada, with the exception of really just Quebec and Manitoba only permits home cultivation with a medical license, Canadians are now permitted to grow their own cannabis at home in quantified amounts. And so many of the risks that we see with home cultivation are similar for those in commercial production. But now, instead of talking about residual toxins, we're talking about pets that are potentially facing exposure to the gross products. Things like fertilizers, when ingested, can lead to GI signs, vomiting, diarrhea, pancreatitis. Bone meal in sufficient quantities can start to congeal and may pose a risk for foreign body obstructions. High levels of iron can cause GI bleeding and tachycardia, lethargy, liver kidney damage. And nitrates in really high quantities can cause vasodilation, methemoglobinemia. For everybody who loves compost when you're gardening, I mean, it's a wonderful product and it's great for growing cannabis as well. But if you're starting your own compost heap, it might just be a pile of food scraps in the backyard. That can attract animals to the smell of food. And just like animals getting into the garbage, GI signs associated with general dietary indiscretion can be expected. More concerning would be the ingestion of tremorgenic mycotoxins that can be found on moldy food. And those are going to present with more severe signs where we really need to be focused on decontamination and then getting those seizures or tremors under control and trying to prevent hyperthermia so that we don't develop DIC. Aflatoxins, we talked a little bit about there as well, and certainly a potential risk with compost ingestion. And so again, pesticides, just like in commercial production, home cultivators will use all sorts of crazy things to control pests. Oftentimes because they're not as educated or knowledgeable or concerned about the risk, they might do really silly things like spray Raid directly on their flower that they're going to then ingest. Not a great idea. Probably a bigger concern though is just having these products out and about. As a residue, it's not an issue, but for things like diatomaceous earth, which is a relatively benign product if ingested, if it's inhaled. So if the dog gets into the grow area and inhales those, we know it can cause pulmonary inflammation and possibly lead to chronic pulmonary disease. Licking up a bunch of canola oil can certainly cause GI problems and pancreatitis. So while it's a safer pesticide, depending on the route of exposure, it may cause some problems in our patients. And no doubt we're running really short on time, but just bear in mind that home cultivators are trying to protect their crops from everything, including rodents. And so the use of rodenticides may be used on the property. And just because they think the dog won't get into it doesn't mean they won't. It's not always just our warfarin types. We've got our first and second generation anticoagulant type products. We've got neurotoxins. We've got vitamin D based products that can lead to kidney damage. And if you've never heard of zinc phosphide rodenticides, pray you never get one. It causes often hemorrhagic vomiting in those animals that can vomit, as well as tachypnea, ataxia, weakness, trembling, collapse, seizures, and death. But what makes it even more dangerous is that when it combines with water and stomach acid, it produces phosphine gas, which then poses a risk for hospital staff that are rushing the animal back to induce vomiting. So if you know that you have a potential zinc phosphide rodenticide case, they're often sold as gopher baits. Make sure you're taking them outside or to a really well-ventilated area before you induce emesis. And then just to tidy everything up, disinfectants. COVID already brought this topic to the forefront as everyone was at home trying to disinfect everything. Cultivators also want to do everything they can to reduce the risk of disease and contamination of their crops back and forth. And so to do that, they're often being very vigilant at disinfecting their grow space between grows. Of course, keeping stuff clean is great, but we do have to be aware that pets may become exposed either through dermal contact or inadvertent splash up into the eyes, or through ingestion if they're licking these products off their paws or off their fur. And so things like bleach and alcohol and the quartz, peroxide, phenols, all of these, we just need to be aware that pets may be getting exposed to these, whether it's through home cultivation or just people being extra clean these days. So as cannabis use and cannabis cultivation becomes more popular, I hope you guys might just remember some of today's talk when you're presented with those ill patients that maybe aren't just your typical straightforward THC intoxications. And I think we've got all of about a minute for questions, but I'm certainly happy to answer questions via email if we've missed anybody.
All right, and joining us here live for questions is Dr. Sarah Silcox. So if anyone has any questions, be sure to drop those in the Q&A box at the bottom of your screen. Welcome, Dr. Silcox.
Thanks so much. I haven't seen any questions come in so far. I think today was a lot of just bringing awareness to the different types of toxins that we can see associated with cannabis and cannabis cultivation. But if anybody has any questions, I'll be hanging out at the CAVCM booth a little bit later today after the next presentation, or you can certainly email me directly at the CAVCM email.
All right. Are there any frequently asked questions you usually get in this presentation?
I think most of them, people have become better equipped to recognize and to deal with the THC intoxication. So a lot of the questions we get are more in line with drug interactions, and certainly with those co-toxicities that Dr. Etier spoke about earlier.
All right. Perfect. Well, I don't see any more questions coming in, and we are almost out of time, but is there anything else you'd like to add to your presentation today?
No, I don't think so. I hope some of you that were in this lecture will join us for the following lecture that's focused more on regulations and discussing products with clients.